From our Staying Healthy department, breast augmentation. More than 400,000 women will opt for it this year.
And now there is a new option for women afraid of the scars that can be left behind. Stacia Matthews is here with more on this new procedure. Stacia?
That's right, Trish, a virtually scar-free breast augmentation. Now, this procedure has been around for a few years, but it wasn't available here in Indiana until now. Fashion flaunts it. Movies inspire it. Even companies sell push-up bras to enhance it. But for some women, that's not enough.
I think I was always kind of self-conscious growing up, and I think as a woman you do, I think, compare yourself to other women.
This woman, who we will call Susan, is a registered nurse. She knew the risk of augmentation but was apprehensive about implants being placed through the nipple or around the breast.
I just didn't want to have the chance of having any sort of disfigurement that would be visible.
But she learned about a technique that calls for enlarging breasts without scars anywhere on the breast.
The whole purpose of a breast enlargement is to enhance the appearance of the breast. Using this technique, then there isn't a scar on the breast to detract from its appearance.
Dr. John Aker's practice is the only one in Indiana offering this endoscopic procedure. He makes a small incision in the crease of the armpit, uses a tiny instrument to make a pocket in the base of the muscle.
What I do is roll it up like a little tiny taco.
Fits the implant under the muscle for a snug fit, and then fills it with saline for the right size.
It's actually easier and more accurate, and I think there's less chance of bleeding or complications afterwards.
The scar heals in the natural crease of the armpit.
What I like to tell my patients is, if after surgery, even if they're waving at somebody, if somebody's looking at their armpit, then I haven't done something right.
Susan is all smiles since she got her implants last summer, and the good news that the cost is comparable to traditional saline implants.
I knew people would be curious about that.
Yes, they would.
So this is relatively new to Indiana. How many procedures has this doctor done?
Well, Dr. Aker has done more than 1,000 of these procedures, and he says he prefers them because the breasts actually look natural when everything kind of settles down, no pun intended, and there's less likely a chance that they will interfere with a mammogram, which is good news for women who have concerns about that.
All right, very interesting. Thanks so much, Stacia.
You're welcome.
6 News is covering America tonight, beginning in Maryland.